Welcome back to the approval process, the podcast where we explain what gets our approval, and more importantly, what helps you get approved. I'm Sophia, your pharmacist.
And I'm Julian, asking the questions everyone at home is thinking. Today we're talking about a medication that's been generating a lot of excitement. Zepbound.
Did you know that nearly 30% of all prior authorization requests for medications are delayed because of incomplete documentation? That's almost 1 in 3 patients waiting longer than they should for treatment.
Wow, that's a staggering number. And I'm guessing today we're diving into why that happens and how it can be avoided?
Exactly. Today we're focusing on Zepbound, a medication for patients with obstructive sleep apnea who also have obesity. It's a perfect case study for understanding how small gaps in documentation can lead to big delays in getting medications approved through Medicare Part D.
So we're talking about the fine print, the details that can make or break whether someone gets their medication on time.
That's right. And it's not just about paperwork, it's about the real-world impact on patients. Obstructive sleep apnea, or OSA, is a serious condition. It's not just about snoring or feeling tired. Left untreated, it can lead to high blood pressure, heart problems, and even strokes.
And when you add obesity into the mix, it becomes an even bigger health risk, right?
Exactly. Obesity is a major risk factor for OSA because excess weight can put pressure on the airway, making it more likely to collapse during sleep. So when a medication like Zepbound comes along, which targets both conditions, it has the potential to be life-changing for patients.
But only if they can actually get it approved through their insurance.
Exactly. And that's where the documentation comes in. For Medicare Part D to approve Zepbound, the patient's medical records need to clearly show two things: a diagnosis of obesity and a diagnosis of moderate to severe obstructive sleep apnea.
That sounds straightforward enough. But I'm guessing it's not always that simple in practice.
You're absolutely right. Let's start with obesity. Medicare typically defines obesity as a BMI of 30 or higher. The documentation needs to include the specific ICD-10 diagnosis code, which usually comes from the E66 category, as well as the patient's actual BMI, and the corresponding BMI code from the ZD68 category.
Okay, so that's obesity. What about the sleep apnea side of things? Isn't that just a matter of saying, this patient has obstructive sleep apnea?
Not quite. Obstructive sleep apnea, or OSA, is classified by severity: mild, moderate, or severe. And that severity is determined by something called the Apnea-Hypopnea Index, or AHI. It measures how many times a patient's breathing is disrupted during sleep.
So the documentation needs to include the AHI score?
Exactly. For example, moderate OSA is defined as an AHI of 15 to 30, and severe OSA is an AHI of greater than 30. If the prior authorization form just says obstructive sleep apnea, without specifying the severity or including the AHI, the reviewer might have to go back to the doctor's office to request additional records.
And that's where the delays start to pile up.
Exactly. It's a domino effect. The reviewer requests more information. The doctor's office has to dig through records to find it. And all the while, the patient is waiting for their medication.
What about patients who are already using a CPAP machine? Doesn't that kind of prove that their sleep apnea is significant?
It does, and that's a great point. If the documentation shows that the patient is being treated with CPAP therapy, that usually indicates moderate to severe OSA. Including that information up front can make a big difference in speeding up the approval process.
So what are the most common mistakes providers make when submitting these prior authorizations?
There are a few big ones. First, only documenting obesity without mentioning sleep apnea. Second, submitting just the diagnosis code for sleep apnea, G47.33, without specifying the severity or including the sleep study results. Third, not including the patient's BMI or mentioning BMI less than 30. And fourth, submitting only diagnosis codes without any clinical notes to explain the patient's condition.
It sounds like a lot of these issues could be avoided with just a little more attention to detail.
Exactly. A complete prior authorization packet should include the obesity diagnosis, or the patient's BMI, or the appropriate ICD-10 and BMI codes, and the sleep apnea diagnosis, the AHI score from a sleep study, or documentation of CPAP use if applicable.
It's like putting together a puzzle. If even one piece is missing, the whole picture doesn't make sense.
That's a great analogy. And the frustrating part is that these missing pieces are often small details that could easily be included if providers knew what was needed up front.
So what's the takeaway here for patients, providers, and pharmacists?
For patients, it's about understanding that delays in the approval process aren't always about their condition. It's often about how well their condition is documented. For providers, it's about being thorough and including all the necessary information the first time. And for pharmacists, it's about helping patients and providers navigate the process and understand what's needed.
It's one of those things that seems small but can have a huge impact on people's lives.
Exactly. A complete prior authorization can save days or even weeks of unnecessary delays, which means patients can get the treatment they need sooner.
So if you're a provider or pharmacist listening to this, take the extra time to make sure your documentation is complete. And if you're a patient, don't be afraid to ask questions and advocate for yourself.
Well said. Together, we can make the approval process a little smoother for everyone involved.
And on that note, I think we've covered everything for today. Any final thoughts?
Just a reminder that clear documentation isn't just about getting approval. It's about ensuring that patients get the care they need as quickly as possible. So let's all do our part to make that happen.
Agreed. Thanks for tuning in, and we'll see you next time.
Until next time.